Hello YouTube, this is AugustusLarch. And it's about time that I delivered my vlog on the medicine cartel. The medical industry in this country. Healthcare, is how most people call it. I'm going to explore how such a system is just a scam and ends up causing more damage than it helps. Let's explore this. First of all, when you're going to explore the healthcare industry, or the medicine cartels, like I like to call it, look for doctor candidacy, the highest level position, or any position in between. Children in school are taught that healthcare is a really good career because people are going to need healthcare, and it makes money. It's all to do with, I'm going to get money from this. I'm going to look at all these other people in the healthcare industry. Look at their nice houses. Look at their golf membership. Look at the nice fishing boat they have. And they have a vacation cabin. Oh, and they take long vacations, and it's so awesome. And all they got to do is get indoctrinated into this medicine cartel. That's great. You know, that's exactly what they say to them. But look what kind of thing that they get into. Doctor candidacy, or anybody in the healthcare candidacy is what you could say. The first goal that they want is money. I want to be financially well off. Yeah. So it's a great industry. It's great. And the ideal goal of people going into healthcare to be a doctor is to help people, is to heal people, to make people more healthy. But that doesn't happen. Overwhelmed if you take surveys and people going into medicine. Yeah, I'm looking for that big fat paycheck. That's what I'm looking for. And having that control over people's lives. Really. Look at the character of the medical system, of who they get in this first little feeder thing. They don't get the people ideal. They end up being veterinarians and stuff like that. For real. Yeah. And artists and writers and whatnot. See, the medical system, the character of personnel from the candidacy situation, you get people with misplaced goals. And if the system's going to keep working, they got to sell sickness. And they're not working at preventive goals and like that. They couldn't care less about that. All they want to do is get those beds filled. They want to fill beds. The results of that character is, we want to fill the beds, and we would do this by victimizing patients. We don't really want them to get better. We'll get them their mind indoctrinated in the fact that once they start coming here, they're going to have to come here a whole lot. Yeah. We're going to have checkups. We're going to assign every damn test that's in the book on this people. Oh, we're going to do some preventive procedures. Oh, not preventive like looking at their diet, looking at their activity level, at their wellness score, their way of behavior. There's some of that, but it's total token stuff. Most of their wellness is make sure you show up at this place and make sure to make the checkout to us. That's pretty much what the bottom line in the medical industry today. That's the kind of people they get, so what do you expect? You come in there with people and you're sick. And at the most vulnerable time in your life, the only people that are going to help you are people that are there that have a pre-existing system that gets them paid. That's the primary goal. They need return customers. They'll victimize you anyway from Sunday. They'll give you unnecessary surgeries. They'll give you unnecessary medication. They'll they'll disrupt your life. Just so they don't, as long as they don't kill that. Oh, and they make sure you're employed. They love that. Your employer kicks in with a bunch of money. So not only are they financially raping the person, the company as well. And where do all these costs go? Really, it's all a cost. They call it an industry, but it is a cost. There's nothing being created here. There's no products being, there's no advantage. It's only a detriment to society. And somebody says, Well, if you didn't have the doctor, I wouldn't get sick, really. These guys that sell sickness, that sell you fear, that say, you have to come here all the time. We're going to net you in some way. I bet we're going to find something wrong with you. Really? And then if you do have to go there at an inopportune time, if you don't get sucked in, they'll suck you in any time beyond that. Saying, yeah. And instead of getting somebody that's there focused on healing you, you get somebody focused on assigning the most drugs and medical procedures and tests they possibly can to keep their big white elephant facilities rolling. That's their primary concern. Oh, we want to get you back here again and again. Oh, we could cure you and fix you, but we have to see you some more times. We have to get some more checks out of you. Yeah, we need more of your money. So, here's, you came here and you thought this was wrong with you? Oh, this is wrong with you, this is wrong with you. By the way, you need medicine for this. We gotta run this test. We found something else. We need to test that. We're gonna put you through a screening. That's gonna cost you money. And the screening will probably net something else for us. They don't tell it to you like that. But in their head, the dollar signs are rolling around, you know? Their little freaking hand crank till ka-ching, ka-ching, every time. That's what they're focused on. So, you know, the remedy for this is there's gotta be a renewed ground roots philosophy to say that, you know, the medical industry, try to avoid it. Let's look on having a good diet, having good activity, having good mental health. Let's have public awareness to have good morals, to know that morals are not something that, is handed down from God. He's going to strike you down if you commit adultery. No. Morals is a broader scope than that. All the old Greek, Plato, Aristotle, Socrates, they were moralists. They thought that it was those rules, hard and fast rules on how to deal with things, freed up the mind for more important concerns, really. It's gone in this society. And prevention. I mean the fitness, mental and physical fitness, mental fitness too, not to realize that these medical people are scamming you. Check up on if they actually know anything. No. They've been job trained to just make that freaking doctor bill, the hospital bill, as big as possible. That's their primary focus of their education. And health, you know, diet, activity, and rest. People don't rest anymore. They sit there, they hardly have any activity all day, and then they go to bed at night. I don't feel tired. And they watch television all night. What does that do to their head? Not anything good? Check out the world. Anyway, this was AugustusLarch, and I'm trying to get my word out. I don't have the soapbox that the big old broadcast television thing does, but God bless it, I'm going to try anyway. And everybody listen to this vlog and take it to heart, please. This is AugustusLarch, and thank you for watching YouTube.